Thank you, Kabir. Thank you, Qualcomm, for putting together a great panel today. So, as you just heard, we have 3 software companies, a consumer device company, and I come from a medical device company. So, my name is Rich Yang. I'm the vice president for our corporate accounts and our connected solutions. And Dexcom is a medical device company. We create continuous glucose sensors for diabetes management. So we'll be speaking about our technology. So let me have each one of the panelists start by introducing themselves and their company. Maybe we spend a minute each, and then we'll dive into the topics for the day. So please, Lindsay.
Great. Thank you. Lindsay Irvine, Director of Business Development and Strategic Partnerships at Salesforce. I'm also managing a new partnership area for us called Salesforce Wear, where we're really taking a very serious look and investing in wearables technology. So excited to mention that. And my background before is all in health. I was the first employee at a company called Kias, which is focused on enterprise health and wellness. And before that was at the National Institutes of Health, focused on funding technology to get research into the hands of those that need it. So excited to be here.
I'm Matthew Diamond, and I'm here representing Misfit. We make elegant wearable activity and sleep monitors and smart home products. And I'm wearing one of them here on my lapel. It's the Misfit Shine. My background is in medicine as a sports medicine and rehabilitation physician, and excited to be here talking about opportunities for wearables.
Morning, everyone. I'm Mickey Nash, co-founder at the Activity Exchange, which has a platform called Achievement. And we are focused on bringing the science of consumer marketing to the healthcare challenge. My background is in consumer marketing. I come from the retail financial side of the world, where we're awesome at selling you debt you don't need. And so bringing that level of analytics and capabilities to health is what we're focused on.
Hi, everyone. My name is Pan Wong. I'm Director of Partnerships for Jif, and Jif is a health technology company based in Palo Alto, and we make beautiful, engaging software and applications, mobile-first applications, that help employees manage and engage in their own health and wellness. Can you hear me now? My name is Pan Wong. I'm the Director of Partnerships at Jif. Jif is a health technology company based in Palo Alto, California, and we make beautiful, engaging software and applications for employees to help them engage in their own health and wellness. Prior to Jif, I worked in management consulting at Monitor Group in the US and abroad, helping to reform health systems, as well as helping life sciences medical device companies go to market, and along with some corporate strategy work.
Thank you. So before we get started, I want to just take a quick poll of the audience. How many of you have worked on something in mobile health in the past 12 months? Raise your hands. Actually, better yet, stand up. Stand up. Those of you that have done something in mobile health in the last 12 months, we need to give you a round of applause, because this is the most underserved area in terms of creating disruptive change. So all of you collectively had created disruptive technologies for music, entertainment, transportation services like Uber, but why not healthcare? So that was good to see that there are people actively developing solutions here in mobile health. So I wanted to start by asking the panel, what is the greatest barrier to entry when you guys were planning to roll out a mobile health platform? And maybe we can just start with Lindsay.
So I'd say number one is the perception, and this is less from Salesforce standpoint, I think from a market in mobile health perspective, is the business model. Where's the money, right? Because when you're thinking of building an app, you need to know that you're going to be able to build a successful business, and part of that is getting paid, right? Finding a buyer, knowing there's downstream impacts of that. 5 years ago, it was less certain that B2B mobile app development, where the money flowed. And I think today that's becoming more and more relevant and more obvious as we see change with the Accountable Care Act, payers and providers really investing here, as well as employers. And so from a Salesforce.com perspective, we're the #1 CRM platform. We are now taking a very serious stance in industries, in healthcare in particular. It's not a secret, or it shouldn't be a secret, but we're also a very large platform company. We have over 1.5 million developers building apps on Salesforce. A company called Viva, which is a healthcare company that went public last year for a little over $4 billion, is built on Salesforce. And the reason they did that was because they saw a need to verticalize CRM for the pharmaceutical industry. They're now a very large company. They leverage Salesforce to accelerate time to market and to leverage our 15 plus years investment in the CRM space. And so I think as you look to building mobile apps, 1, there's now money there. 2, it's focus, and 3, it's picking the right platform to accelerate that time to market.
Just a quick question. How many of you knew that Salesforce.com had a mobile health arm or is developing a mobile health arm? Thank you, Lindsay.
So, can everyone hear me okay in the back? Great. For Misfit, when we decided to enter, digital health, and specifically with our consumer physical activity and sleep monitoring products, the question is, who needs another activity monitor, and how can we distinguish ourselves? When we launched our product, you didn't see the type of presence with activity monitors that you see today in electronics stores. And today, if you go into Best Buy, the Apple Store, you'll have shelves and choices of products to use. Distinguishing ourselves as showing the value in the device that we bring, making it unique, making the device something that people feel good about wearing, and essentially convincing for this consumer device retailers to promote and to highlight our product. And for us, we actually looked at a lot of the pain points that people reported in the reviews of users who were out there using devices, and we tried to address those barriers when we introduced our product.
How did you decide upon which metrics to track and provide to consumers?
Yeah. So we started out using basically the physical activity, and you had devices that had been out already for a couple years, like the Fitbit, which primarily tracks steps. But we wanted to capture more activity than just steps. We wanted people to be able to track their swimming, to track their bicycling. So we used a system of points that basically tracks everything. So you could use the Shine, play basketball, play soccer, play tennis. And we wanted for our users to understand that everything that we do during the day, whether it's walking up the stairs, walking to work, bicycling, all of those things have a significant impact on their health. So we wanted to broaden the physical activity measures we used, and then we also realized that the flip side of activity is sleep. And we're tracking movement. We have a device that is really comfortable to wear, and that you don't have to take it off to charge at night. So we really wanted to leverage this, and that's how we decided to get into sleep monitoring as well. And it's been a really rewarding area.
Thank you. My guess is that more than 50% of the audience here owns an activity monitor. If you own an activity monitor, raise your hand. Yeah, great. How many of you have used it for stress management? Almost nobody. So just to share a quick story that we were talking about before this panel. So my wife is a nurse in San Diego in critical care, and she has 12-hour shifts. And from this panel last year, one of the audience members came up and asked me, "Hey, is there an activity monitor that can track stress?" And it really made me think. And I said, why don't we take something that is currently available on the market and apply it for stress? So I put on an activity monitor on my wife that she takes to work every day. I'm now able to see how many miles she's walking per day as a nurse on her 12-hour shifts. So she averages 4 miles per day. So when she comes home, the first thing I do is I check, and if she's walked 8 miles, I know she's going to be in a bad mood. So I will prepare dinner, and I'll take care of her, give her a massage. It makes me a better husband, right? And when I see that she only did 2 miles, she didn't have that many patients, she's in a good mood, she gives me the massage and prepares dinner. Great, thank you. Sorry to digress. So Mickey, please.
I think there's a couple of challenges in health. The first one is something that most people in this room probably haven't seen. It's called .NET. I think it was out before. And when you go into healthcare, one of the most interesting things is you sit down and go, great, what platform do you have? And they go, we have .NET. So something about going back to the 80s is one of the bigger challenges that you have in trying to bring people into this new world that we live in. And the other challenge that you have is we're working in a really cool space. So you'll often have conflicting internal programs that will compete with you where they should be partnering with you. So I think from a business model perspective, those are the two things that if you get ready for them, you can actually face them and really work around them. But the one is harder. .NET is still a little more difficult, but the partnership one is one that you can get through.
Pan, and the question is,
what are the barriers?
What are the barriers when
Yeah,
you're planning?
and I'll speak kind of broadly, not necessarily specifically about Jif. I would say there's 4 things that I can think of, 2 that are broadly applicable regardless of your industry, and then 2 that are sort of specific to healthcare. Focus, right? So I can't remember who said this, but healthcare is not a $1 trillion industry, it's like $10 billion industries. And knowing which one you're tackling and getting really deep is very challenging. Secondly, is related, is a deep customer understanding. So we work with directors of HR and directors of benefits, and knowing their needs is a pretty niche proposition, right? So we have to know incentive design, and we have to know their purchasing cycle, and again, sort of being very close to the customer is tough depending on which healthcare market you're going after. And the 2 that are specific to healthcare, regulation, like regulatory issues and legacy issues. On the regulatory side, it could be de facto or it could be de jure, right? Like you may not need HIPAA, but everyone expects you to have HIPAA compliance just to check the box. And that can be intimidating for some folks, right, as a barrier to entry. But if you understand it, it's actually not that big of a deal. And then fighting sort of the old guard and legacy stuff is always a challenge, I think, in this industry.
Thank you. Lindsay, I think all of us, you saw how many people were aware of Salesforce.com having this healthcare vertical. What are your big goals or objectives in creating this vertical? And I assume you're heading up this area. So what are maybe the 2 or 3 goals that you have in mind?
Given the somewhat greenfield knowledge, maybe I'll set a little context before I answer the goal question.
Please, thank you.
So as many of you probably know, we are the largest CRM provider. We're fastest growing top 10 software company in the world. We're also number 1 in not only sales, but service and marketing. So we've acquired a company called Exact Target Marketing Cloud. So we've really enhanced the capabilities of Salesforce. And in addition to that, we have a very large partner ecosystem. So as I mentioned, 1.5 million developers building apps on Salesforce, over 2,400 apps, over 2.5 million installs of those apps. So it's not early, it's very much evolved. And as part of this, Salesforce really sees a huge opportunities in industries. So a year ago, we hired a head under our new president, Keith Block, to really run Salesforce Industries. And one of those key verticals is healthcare. And as part of that, from a developer standpoint, the focus is enabling partners, customers, developers to build and accelerate mobile app development on our platform. And I'll take it even a step further, which is build and extend not only mobile app development, but wearable app development through our new wearable initiative. So in terms of goals, I think number 1 is really inspiring you to say there's an opportunity out there. We have companies as big as Philips and GE building mobile apps for healthcare on our platform, to eVariant, which some of you may know, and Viva. So it's very much a growing ecosystem. We have over 100,000 customers that developers can tap into by building apps. So it's really to inspire and grow the ecosystem is one goal. 2 is to learn from you, so we can continue enhancing the platform in healthcare specifically. So making sure that we have all, the platform today is HIPAA compliant, it's secure, it supports all the things that you need to build and accelerate a healthcare specific app, but we want to keep learning from you and making it better and better. And then 3 is really bringing together your app with our ecosystem of customers. So the win ultimately is not building an app. We actually have a whole partner team that's dedicated to helping you. I wouldn't say ensuring your success, because that's part of your job. We can't guarantee it, but really helping you get there and aligning your app with our customers.
Thanks, Lindsay. Mickey, so who are your customers, and what were some of, maybe if you can give us 2 examples of some key insights you generated from your customer base last year?
Okay. So we go payer and we go in the life sciences industry. Payers are the new business that we're in. Last year we were still doing all the life sciences. And one of the things that you're learning in life sciences is they're trying to go, what they'll call go beyond the pill. So how do they develop services around the drugs? Because as affordable care happens and as outcomes-based payments happen, the people that currently are not getting reduction in pay are the pharmaceutical companies, but it's only a matter of time because drug efficacy is off incredibly. And you can look at something like simple as Lipitor, which is the single most expensive drug that we have, and efficacy rates are 30%. I always like to say to software people is, can you imagine we can write a platform, it only has to work about 30% of the time, we still get paid 100%. It's not going to go on. So that was the place that we sort of put ourselves. It's a very good place for anything in the mobile initiatives because you have to be in people's pockets, you have to be collecting data, and you have to be able to time interventions. So the ability, that's our first primary marketplace. What was interesting in that market is you're still, even in the life sciences, they will talk to the services arm, but they still want to sell drugs. So you have to remember that when you're looking at them, there is a very almost socialistic conversation that happens about helping people, and then you get to the marketing team and it's like, so how are we going to get script lift again? And that metric is still very key in it. So I think when you're thinking about it, when you get to know your customers, don't forget that they still actually have to do that. I think that's one of the key things when you're selling into them. Your partnership has to address that. Next year or the year after, it'll be more about outcomes, but today we're still focusing on that. So I think that's key when you're thinking about your business models. The payer world is much more interesting because I think they're much closer to disruption, and I think they're feeling the pressure a lot more. If you look at Boeing's announcement, I think it was yesterday, that they're cutting out the payer and they're going direct to the ACOs. Walmart's already doing that. So you're starting to get the actual employers managing their own healthcare services. And so that little percentage that those guys rely on is going away. So anything that you can do to create value in those services. If you look at something where Humana is moving very strongly into, they have to redefine themselves, they're going to be a wellness provider. They're going to be an ACO. They're going to be all sorts of things. So if you're picking platforms, that's probably the one that's closest to disruption, and it's the one that's most open to innovation and has realized they can't fund it internally anymore. They've got to go outside. So you're starting to hear that language of, we've got to bring the outside in. I've heard that so often recently. And so those are the 2 markets that we go after. And I think the key insights there is legacy is hard, but they're all changing right now. They're all sort of Pivotal Labs is in a lot of places right now, rewriting everything. And so it's the thing of don't give up, keep going in, because they are, although they've been slow to change, they sort of are at that friction point right now where this could be the tipping point when you're thinking of the pay world.
Thank you. So I think that was a good warm-up series of questions, and now I think it's time to have the panelists disagree a little bit more, don't you think? So one of the 2 most difficult areas in mobile health, one is creating the appropriate incentives to drive behavior change. How do you do that, right? And number 2, sustainable business models, right? So let's tackle the first. Do incentives really work in creating behavior change? And maybe I start with the consumer device company. Do you really believe that incentives work to create behavior change? And then we'll ask the software side following you.
Yeah, so behavior change is difficult. Weight loss is a really tough area to tackle, and getting people to be healthier. We would save billions and billions of dollars if everyone in this country had an activity tracker and increased the number of steps that they were taking, their activity by even, a modest 20, 30%. So, I mean, the impact on healthcare would be amazing. How do you do it at a grassroots level with each individual? So,
so how do you create those incentives as a device company for the user to come back, continue using your product and creating that behavior change?
Yeah, so what we feel is incredibly important is the community engagement that a user experiences when he uses a product and he uses it in a context of his friends, his family, his community, and his provider. When you're using a tracker, and in our system, you can be part of a small group, and even if it's you choose 4 or 5 people or a larger group of people, and you can follow their challenges. And the way that, typical motivation can wax and wane for any one individual, but the motivation of the group, helps to sustain those who might, be sort of, falling off the wagon any particular day. So we try to use the power of the group, that's one thing, and we try to use momentum with the idea that we recognize that whenever you take off a device to charge it or because you're going to go for a swim if it's not waterproof, that's an opportunity to just never put it back on again. And so we feel, our experience, we have a lot of people will say, oh, I've been using your device, I haven't taken it off for a month, because it's easier to leave it on than it is to be taking it off and put it back on. So we try not to lose people through extra burdens that a device would have to provide. And we try to keep people together in groups to support each other.
Mickey, do you agree incentives work to create behavior change?
No, I don't. I believe that incentives work to get people engaged in the first place, but I don't think there's a silver bullet. I think we know enough about behavior change now that we know that it's really rare that it's sustainable.
So reward mechanisms and incentives don't work in the long term.
They work really well to get somebody engaged immediately, but they don't. It's not going to last. You get rewards fatigue or points fatigue or any other normal human response to everything. It gets boring.
So I have to have the 2 platform software guests speak to this. How do you create behavior modification through incentives, through your programs, through your platforms?
Yeah, I think being fairly diplomatic here, I think both panelists are touching on correct points. I mean, if you say, I'm going to give you $500 to do a biometric screening this year, that's not going to incent someone to lose weight. Or even if you say, I'll give you $500 to lose 10 pounds next year, that's not sustainable in the long term. But
you want to be closer to your microphone?
It is great for engagement. So one of the things I think people who study behavior change, it's really about, I think, this real-time feedback loop, right? So you give this incentive, but you don't make a person wait a day or a week to understand how they did relative to their social group. You give them sort of that real-time satisfaction so that this behavior starts becoming Pavlovian and sort of ingrained in their daily activity. One of the things I think is important that people often forget in health is that, well, one, we have very low expectations of like design, service, everything related to our healthcare system, right? But more and more, that's not acceptable anymore, right? So we, from an incentive, whether it's incentive design or hardware design or payer service, you're seeing sort of innovations that are at the human level, like human-centered design and human behavior change, and so going back to the original question of do incentives work, I think they are very important in our business model and for our customers, right? So our employers give financial or non-financial incentives and rewards, but we also build around that social features, and then within the sort of distinct corporate cultures, they may be more collaborative or more competitive, and we really do focus on how to customize and make sure those customer experiences are tailored not only to the corporation but to the individual. So I would say it's very hard, and I think we're all still trying to figure it out.
If I can just go back to that, I think when you're thinking of behavior change and you're thinking of engagement, you've got to think of it like a marketer, because it has to have all of those components. You've got to have the ability to engage them. You've got to have the ability to sustain a relationship. You've got to have the ability to reignite a relationship. So if you address it like a marketing problem and put all of the components of a good marketing plan in place, you're going to get a better idea of how complex it is.
I would say, kind of to the point of this panel too, business model. How do you build apps that can make money? I think, my opinion, perspective from Kias is, if you don't have incentives, that's a big box you're not checking. So to Mickey's point, I think, does it drive sustained long-term behavior change? Jury's out. Does it drive and incent immediate adoption of technology in your application? Absolutely, right? Here's $500, sign up, I'm in. So, here's a really cool app, it changes your behavior. Not that cool. So I think you need it to make money, because I think every employer, every payer, incentives is a big buzzword today. And so it's a big check the box. And in terms of actually, driving near-term adoption, I think it's also really critical. To the point that was made in terms of behavior change over time, we found that team-based collaboration, social collaboration, was 6 times impacted a user's ability to stick with and change their behavior by 6 times. So I think that's collaboration, team support is really what we've seen as the longer-term stick.
Thank you. Quick anecdote to Mickey's point on the marketing. I was running yesterday in Dallas, and I saw a dentistry shop, but it was branded Mint Dentistry, and it had this beautiful green lettering, and it made me actually want to go to the dentist.
How many of you have created a mobile health product or service in the last 12 years that generated $500,000 in revenue? Raise your hand. One group generated more than $1 million last year, more than $5 million last year. One person, more than $10 million last year. Fantastic. So there's a long way to go. I just wanted to highlight one. Coming from Dexcom as a wearable sensor company, we have generated over $500 million in disposable sensor revenue over the past 3 to 4 years. 500 million. So, but we quickly realized we can't play in this mobile health space without having a core competency in software, cloud-based software, real-time remote monitoring. So we went and acquired a software company, a health information technology company, and upon acquiring it, their business model was direct to consumer. And how long do you think that lasted? Consumers would not pay $10 a month for their own data. What are they going to do with it? Nobody signed up for it, right? Then the company transitioned to a clinic-based service. Let's provide all the data to the clinics. Guess what? The clinics didn't have money to pay for the service, and for the ones that did, it took 9 months to get all the legal agreements for privacy, security, BAAs together. It was not scalable. So it took me 9 months. We found a general manager for SweetSpot, George Zamonico, sitting out here, arguably the smartest person I've worked with, but we then changed the model again, went B2B. And for the first time in the diabetes space, for historical data, $1 million contracts are being signed. For the first time for historical data. So bottom line is, your business models will evolve. You need to find the right place, the right time, and your technologies will then flourish from it, and the business models will evolve. But so what were some of the big challenges for you in terms of developing your business model? And what would be the key technology missing in your portfolio that you are desperately seeking right now? Anybody? Pan, since you curate the best-in-class technologies for your customers, what are those technologies that you're missing in your portfolio that you'd like to see?
Richard, our Jif is a platform that allows employers to curate the best wellness categories, apps, devices, and services out there, and they get to select which companies, which products that they want to use. And one area that is has a lot of money thrown at it, there's a lot of incentive, but there's not a lot of great solutions, is smoking cessation. So if anyone wants to build us or build yourself a great smoking cessation app, tool, pill, that's an area that employers really care about. It has a dramatic impact on personal health, obviously, but there's really been not that many good options for smokers. So that's a category that I'm personally very interested in seeing more innovation in.
Lindsay, are there specific wearables that you're looking at that you think will be a game changer?
I think, so kind of to your earlier point in terms of, considering different business models, B2B is our entire focus. We absolutely see B2B2C happening where we're reaching end consumers, but in terms of where the money's flowing, all the partners we work with and from a market perspective are really focused on building apps to sell to businesses, be it payer, provider, pharma, employers. And I think today that stands true, which is really that's where the money is. In terms of opportunities, applications, so from a wearable device standpoint, there's a lot of innovation that's happening. And I think we're going to still see a lot of innovation that happens in terms of form factor and people taking cues from the Apple Watch and putting sensor data in, all this stuff. So I would say from a hardware device, I expect that to continue to innovate. We really see the applications as the key area of opportunity. So when we look at partners and kind of focus their attention on, okay, how are you going to create a game changer app that solves a real pain point today? We see a lot of this around patient-provider collaboration that's happening. We see a lot of opportunity around corporate activity, corporate fitness, corporate wellness, bringing it all together. But I would say kind of more holistically and from a kind of my past experience, I think when you're considering B2B applications and you're considering the buyer, think of them as everyone's coming to them. They have 30 different vendors coming to them selling 30 different things. If you want to differentiate yourself, come up with a way to, platform aggregator is kind of a hard word to say because, it takes a lot of time and money, but think of how you can bring things together for them, because I'm seeing a lot of consolidation happening in the market and a lot of buyers that are saying, I want to work with 3 vendors that do all of this versus 50. So just something to bear in mind.
I think the thing that is missing in health is elegant, human-centered design around actual health. There's lots of great fitness apps. There's lots of good, reasonable nutrition apps. All of that side, the wellness side is pretty well serviced. The health side isn't. And I think that's the piece that's really missing, because if we're thinking about healthcare per se, that's where all the money gets spent. So we're spending all the time on the 1% that's already healthy. There's the top 5% that are, 20%, 80% rule. So of that $3 trillion, it's at the top. And nobody's developing great apps in that space. So there's no good apps for mood tracking. There's no great apps for diabetes. There's no great apps for
do you think it's because of the regulatory landscape and environment, or not enough insights, not enough money in the space? What is it that's holding it back?
I would say money first. Regulation always goes away if there's enough money in. So I think from just a sponsorship, it's true. From the sponsorship perspective, I think it's more a money problem than it's a regulation problem.
Yeah, and I just wanted to add, one thing that we felt was missing, and it was a challenge to a B2B strategy, was if you are working with a large company and if everyone at Walmart is going to have an activity tracker, the actual value that you provide, the cost that's involved with outfitting hundreds of thousands of people with an activity tracker can be a barrier. So lowering that barrier is something to entry with the initial cost of the technology is something that we wanted to address, and we're happy to announce this week that we did come out with a new activity tracker. It's called the Flash, has many of the same functions as the Shine, but it's at about half the cost. And we think that this could really allow a lot more people to be using our products in groups, take advantage of the social features that come around with the fact that it's not just 1 or 2 people that that are using a device, but you have a whole community of folks. So really addressing the barrier to entry with the cost of a device, but actually providing real value for that cost.
Do you think that the likes of Apple and Samsung with their wearables, their smart watches, if you will disrupt your category in the activity monitoring space?
Yeah, well, I think it's a different product. I'm really excited about, I think, all of the focus and the energy that's going to go into tracking and all the exposure so that beyond smaller quantified self early adopter communities, I think will have really mainstream interest in tracking. But a $350 device or whatever it ends up being, it's hard to put one of those in the hands of everyone in your company. But for a device that's much less, to at least get people hooked on the idea and engaging in their own wellness, I think is a real opportunity.
Okay, we want to make sure we have some time for Q&A, so I'm going to ask just 2 more quick questions from the panelists, really quick. One is, raise your hand, panelists, if you believe that predictive analytics and predictive intelligence is going to be a key part of your service offering in the next 5 years. Okay, very good. Number 2,
I think you're setting
final,
us up.
final question for me, and let's open it up for the audience, is, do you think that the distribution channel is the most important aspect of your business? Yes, raise your hand. Wow. Okay, so that says a lot. So the user experience being the most important aspect of your business?
Yeah.
Fantastic. All right. So I'm sorry we don't have enough time to dive further into the panel, but let's open it up for Q&A. So anybody have questions? Kabir has a microphone right here. Great.
One question I have is the importance of patient-controlled records. 1.8 million medical identity theft victims happened in 2013. And you're considering what to do about healthcare. What importance is there for patient control over the health record? Do patients want it?
So, very quickly, on Jif's end, patients are the owners of their data. And the corporations that we work with all get anonymized, aggregated data, and any insights that we provide are at the aggregate level. So patients very much have rights to their own data, is our perspective.
From a medical device company perspective, I would say that patient privacy is probably one of the biggest areas of investment from industry perspective.
A follow-on question to that, not regarding patient privacy, but in the fitness and personal use, that's not covered under the EHR rules. So in his example, if you put a fitness monitor on every employee of your 100,000 employees at the company, that's not actually health. What do you keep people from using it and saying, look, Bill walked 2.5 miles yesterday, you're in the same position, you only walked 1, what's going on? And they start to use these for other functions because now they can metric your activities.
So again, that use case, we explicitly tell our customers you will not be able to do that. So you would never be able to go drill down into an individual and say, you're not doing as well as your colleague, and we're going to change whatever premiums or change your incentives. And whether or not it's regulated, like I was referring to before, I think a lot of our companies will, a lot of our customers will have their own standards that they adhere to. Qualcomm is an example. They are very sort of privacy and and data security is very top of mind over and beyond what's regulated. So we also listen to our customers.
There is an incentive allowance. So the payer community, the insurance community is allowed to give a 30% discount on premiums based on you doing your various health activities. That's a financial incentive, it's a monthly incentive, and you're measured to it. So there's certainly a degree of that joint agreement of I will show you my data, you give me money, that is going to happen. And I actually think it's not a bad thing, as long as it's not used to give somebody their pink slip or to get rid of people or do those kinds of things. I think when it's the only way that this world is going to change is if we all get in it together. And I think 30% off premiums, especially for people that are paying sort of over $1,000 a month on healthcare, I'll take it, and I don't mind sharing my data. So I think there's a transaction that is going to happen between the consumer and the employer, the insurer. There's something where we're going to do this thing of like, I'll show you this. This is my clean driving record, and you give me a discount.
Right. My wife works for one of the largest hospitals in the San Diego County area, And they have a program where she would submit everything that she's eating and her exercise habits for 60 days. And she logs in online every day for 60 days, sharing with her organization what she's eating, when she's exercising. And in return, she gets free healthcare coverage for the entire year. So she does it. And I ask her, why don't you just fill in you're eating rice every day, fill in all the things? And she's like, no, I need to earn this. So she participates. But surprisingly, not that many people do it because it wasn't, a huge financial incentive, but it was enough for my wife and I to do it.
William Harding with Medtronic, and I think that now makes a little bit more sense why we've been able to release apps that are easily hitting the $10 million mark. I'm a distinguished technical fellow with Medtronic, Healthcare Innovation Team, and I love the gadgets. I love the pretty little apps and things that you guys are talking about, but Mickey, got to applaud you on your response. I think you're spot on. So to offer a challenge to you guys, as we build out more of our implantable, wireless, wearable type devices that are actually measuring the patient, diagnostics, sensing, helping the patient sustain life, who on this panel is willing to step it up with a company that's serious about making medical devices? That's what I was hoping for, Mickey. Because the cute apps are fine, the gadgets and things are fine, but we really need to do something in predictive analysis, diagnostics, and the whole deal. So that's where we're seriously looking. Thank you.
Thank you. Great comment. I also spent 8 years with Medtronic, so great company. One of the questions we have, too, is a lot of the bigger companies that are creating truly game-changing, life-saving medical technologies are vertically integrated, and they're not an open architecture framework. So I really believe that now is the time where you're seeing more traditional medical device companies creating more of an open architecture framework to allow a lot more of this collaboration to proceed.
I would just say in terms of kind of the devices, one thing we see customers asking for, and if you take the lens of kind of customer focus and delivering on what the customers need, I think everyone gets the world is changing, right? 50 billion connected devices, 1 trillion sensors that are out there, 5 billion smartphones by 2017. What do you do with this data to make it actionable for your customers and your partners? And so, talking to a lot of CEOs in different companies, they're looking 10 years out and saying there's going to be all of this data, and we've got to figure out what to do with it. We don't need trillions of terabytes of data. We need to know about the 10 data points and what to do with those to make them actionable and consumer friendly. And so from a Salesforce standpoint, that's where we see we're while we have world-class applications, we're really investing in our partners to figure out, we're bringing in that data. What do you want to do with it to create that world-class application, leveraging sales, service, marketing, to really create a compelling customer experience that makes it simple and easy and actionable?
Thank you. One more question.
I'm with Cell. We're a wireless carrier who's developed a product based on the Qualcomm IEM module that monitors diabetes across populations with a company called Telcare. And we've checked all these boxes that Lindsay was talking about before. It's an app or a device they're used to using, has a great app, engagement both ways, bidirectional engagement, but employers love it, and they say, who's going to pay for it? And we go to the Uniteds of the world, and they're, well, it's pretty interesting. We have a lot of clinical data, but the payers don't want to pay for it because the non-connected, Johnson & Johnson, whoever, is doing fine in their eyes. So it's just, how do you get over that last little hump of providing enough data to make the payers pay?
I'll take that one. I think the value exchange has to be the same there. The payers, if they can see the proper care continuum, they'll give you a code and they'll pay you. They're paying for coaches now. So I think the problem is that when you've got a coach, there's a transaction that takes place. The problem that we have on the medical app or the health app side is we're not showing that same value. It's not proven yet. So I think it's up to us in the industry to go put more rigor around the way we do things. I think one of the problems about being mobile app type people is we like to just put it out there and it'll happen and we'll learn over time. That's not okay when you're managing somebody's chronic condition. And that's kind of why as soon as you do, you prove it, they'll give you a code and they'll pay for it.
What's interesting is that the payers don't even know who's using the product that they're paying for and whether they're actually using it or not. So I think you're going to see a transition at some point into outcomes-based payment for technologies rather than just here's the low-price provider on formulary. Kabir, are we out of time? One more question. All right.
Can I add one comment on what was just said? What I think is a very convincing story behind the value of mobile technologies beyond their own impact in health is their ability to demonstrate the value of other interventions that may be completely unrelated. So even a surgical intervention, a certain type of hip surgery, why should a payer pay more or less or pay for that type of surgery at all? And with transition to value and outcomes-based healthcare, the best way to monitor how well a patient is doing after an intervention like a surgery is if you have a device that's with them all the time that keeps track of how active they are, how quickly they can regain their function, and to what extent they can do that and they can sustain that. So even beyond the value that an activity monitor or another mobile technology piece has on its own, and it is valuable to help people be more active, sleep better, take care of themselves. But it's in the best interest of payers to have those devices on board so that they can monitor the values of other interventions that they're paying for as well.
Okay, final question.
Okay, it's first a comment and then a question. So first, my name is Chris Lubkeman, Director for Global Foresight Research and Innovation for Arup. Huge fan of this vector as we're seeing globally. I was in South Africa last week, so part of the question is this a Northern Hemisphere, Western world that we're talking about right here, right now? Or how do you see the applications for this at the base of the pyramid and for those countries and continents who are leapfrogging us anyway as far as telephony is concerned? That's part A. Part B, what are you doing to think about the impact on urban design and understanding perhaps the food deserts, the diabetes islands, and how can mobile health help city managers, city planners, urban designers make a difference in all of our lives all over the world?
Oh, I can certainly speak to the if we take the bottom of the pyramid, one of the most beautiful things about mobile is it's across the third world. It's across all of the developing countries. And one of the best examples of smart interventions using this kind of thing was done in Pakistan. And it was texting, and this is my marketing thing, texting to try and get pregnant mothers to look after their children, their unborn children. And what was intriguing is the state was sending the message and people were reading it and ignoring it. And somebody came up with a brilliant idea of speaking in the voice of the child within. And the change in prenatal health in that particular community with those kinds of interventions changed radically. So this works across the board. Mobile is the answer when you're looking at individual health and individual interventions.
I think we would all agree with you, Mickey. Thank you for your questions. And in closing, I think one of the big takeaways, at least from my perspective, is we only had half the room stand up today in terms of people that are working on solutions in healthcare. And this is the group that can create change, be a change agent, and I'd like to see the whole room stand up next year when we ask the same question. And let's go make some money out there and save lives. All right, thanks everyone.
If you're an engineer and looking for a job, please come by.